Transport. In this module, we will see how to tow an unconscious casualty and how to get them out of the water and onto the shore. Transport in the water. No rescue can be considered complete unless, as well as providing assistance at the site of the incident, the casualty is escorted back to the boat or the shore. It is not easy to give a precise sequence of instructions because the situations can vary so much. The first important factor to consider is if the casualty is breathing or not. The objective of getting the casualty out of the water as quickly as possible is secondary in respect to maintaining the correct rate of insufflations. Only in the case when an action could compromise the rescuer's efficiency or safety should the rate of artificial ventilations decrease or maybe even be interrupted. It is obvious that if swimming for a very long time while giving artificial respiration makes you breathless or prevents you from reaching the shore, you will have to stop giving artificial respiration. When you approach or transport an unconscious diver, it is not necessary to check to see if there is a pulse, as this is extremely difficult to determine in the water. Instead, consider if it might be better to remove some or all of the casualties or your own equipment. You have to assess whether its removal will help or hinder the rescue. In the case of two rescuers, while one uses the fin push technique to transport the casualty, the other rescuer, positioned at the side of the casualty, should give artificial respiration. Let's repeat the order of priorities. Assess if conditions are safe enough for you to act. Take action so as never to put yourself in danger. Prevent water getting into the casualty's airways. Ensure that the casualty is buoyant. Check if the casualty is breathing. If the casualty is not breathing, maintain the correct rate for artificial ventilation. Plan to get the casualty out of the water. Swim back to the shore or boat using the shortest possible route. Take action promptly. Transporting a casualty while using a pocket mask. The use of the pocket mask aids effective artificial ventilation, even in the water. Before using the mask, check that all the parts, the edge of the face seal, the elastic fastening, and the one-way valve are in good condition. However, do not delay administering AV just in order to use the pocket mask. The position is the same as that you used for giving AV in a static position. In this position, you can tow the casualty fairly easily by finning below the casualty's back. You can also use a slightly side-stroke action with the fins. However, you will not be able to see where you are going very well. This is why it is useful for a second rescuer to push the casualty by the fins. Transporting using the do-si-do method. The do-si-do is the most widely known and commonly used position when giving mouth-to-mouth resuscitation to divers not wearing an aqualung. The correct position is important for the technique to be effective. Keep a firm grip on the casualty and fin freely. To give the insufflations more comfortably, push your shoulder against the casualties so that their body rotates towards you. Techniques for exiting from the shore. If your point of exit is the shore, you will have to deal with various difficulties such as waves, surf, current, and the conformation of the shoreline. Before tackling the exit, see if there is anyone else who can help you. However, always choose the most effective method for getting out of the water quickly and which presents the least risk of further injury. During the recovery phase onto the shore, you can't administer AV as well. The objective is to get the casualty to a safe area where they can be treated more effectively. As soon as you reach the safe area, make sure that the emergency services are alerted. Let's examine the order of priorities for exiting from the shore. Assess that the conditions are safe enough for you to act. Take action so as to never put yourself in danger. Prevent water getting into the casualty's airways. Take the casualty to a safe area suitable for first aid treatment. Select an easy exit point. See if there is anyone else who can help you. Act quickly. If the casualty is not breathing, give AV. Exiting with one rescuer. Getting an unconscious casualty out of the water alone is undoubtedly one of the most demanding tasks that you could ever be called on to perform, and success depends on choosing the point of exit carefully. If the casualty is not breathing, give 2 deep insufflations before breaking off to get the casualty out of the water. The ventilation should be started again within 10 seconds. The method you use to get out of the water depends on the weight of the casualty in respect to your own and the type of shoreline you are faced with. These are some methods of transporting and exiting onto the shore with a casualty. Your instructor will demonstrate others and get you to try them. From the dozy-do position, it is easy to apply the sack carry technique. Another technique is the saddle method, but you can only use this method if the casualty is not too heavy. Another technique that can be used if the casualty is not too heavy is the fireman's carry. If the casualty is very heavy, you can choose to use a drag lift. If the shore is steep and slippery, use the jack technique. The situation is different when exiting from deep water onto a low side, and for this it is best to use the technique commonly known as the lifeguard's lift. You may have to carry a casualty up a ladder, so it is important that you make sure that the ladder can support the weight of 2 people. Obviously, you can only use this technique if the weight of the casualty is much less than your own. Exiting with more than one rescuer. It is of great help and much quicker if there is someone else who can assist you in getting the casualty out of the water. In 2, it is best to share the weight of the casualty between you. The lifting and transport of the casualty onto the shore is coordinated by the rescuer holding the casualty's head. If there are 3 rescuers, a sort of stretcher can be created. If there are 4 rescuers, an ideal number, it is best to use the method learned in the PSS First Aid CPR course. Coordination of the action is always the task of the rescuer supporting the casualty's head. A plank, surfboard or a strong towel can also be turned into useful pieces of equipment for transporting a casualty and make the rescuer's task easier. In the next module, we will see how to recover an unconscious casualty onto a boat and how to administer first aid. See you soon.